Alice in Wonderland syndrome, AIWS, is a neuropsychological condition that causes a distortion of perception. AWS primarily affects children and young adults. Most people grow out the disordered perceptions as they age, but it's still possible to experience this in adulthood. This syndrome can affect multiple senses, including vision, touch, and hearing. You may also lose a sense of time. Time may seem to pass faster or slower than you think. AWS episodes are different for each person. A typical episode lasts a few minutes. Some can last up to half an hour. During that time, you may experience one or more of these common symptoms. People who experience this syndrome are more likely to experience migraines. Some researchers and doctors believe AWS is actually an aura. This is an early sensory indication of a migraine. Others believe this syndrome may be a rare subtype of migraine. Micropsia is the sensation that your body or objects around you are growing smaller. Macropsia is the sensation that your body or objects around you are growing larger. Both are common experiences during an episode of AWS. If you feel that objects near you are growing larger or that they're closer to you than they really are, you're experiencing palypsia. The opposite of that is teleopsia. It's the sensation that objects are getting smaller or farther away from you than they really are. Some people with this syndrome lose their sense of time. They may feel time is moving faster or slower than it really is. Every sound, even typically quiet sounds, seems loud and intrusive. This symptom occurs when muscles feel as if they're acting involuntarily. Likewise, the altered sense of reality can affect how you move or walk. You may feel uncoordinated or have difficulty moving about as you normally would.
What are the causes of this syndrome?
It's not clear what causes Alice in Wonderland syndrome, but doctors are trying to better understand it. Researchers believe unusual electrical activity in the brain causes abnormal blood flow to the parts of the brain that process your environment and experience visual perception. This unusual electrical activity may be the result of several causes. Possible causes include stress, cough medicine, use of hallucinogenic drugs, epilepsy, stroke, brain tumor. If you're experiencing symptoms like the ones described for AWS, make an appointment with your doctor. You and your doctor can review your symptoms and any related concerns.
Are there any treatments for this syndrome?
There's no treatment for AWS. If you suffer from any symptoms, the best way to handle them is to rest and wait for them to pass. It's also important to reassure yourself that the symptoms aren't harmful. Treating what you and your doctor suspect is the underlying cause for AWS episodes may help prevent an episode. For example, if you experience migraines, treating them may prevent future episodes. Likewise, treating an infection could help stop the symptoms. If you suspect stress plays a role, you may find that meditation and relaxation can help reduce symptoms. In conclusion, this syndrome may affect your life badly and make you feel uncomfortable. If you are suspected of any symptoms that can lead to AWS, you should see a doctor as soon as possible.